Good morning or good afternoon to all. I'm going to present our study entitled Sexual Dysfunctions in University Students, an observational study. I have nothing to disclose. Many women, at some stage in their life, have problems with sex. Female sexual dysfunction can result in personal suffering and can interfere with both women's quality of life and interpersonal relationships. This is a common problem among postmenopausal women, and accordingly to a recent review, as many as 4 in 10 women have experienced some form of sexual dysfunction. Data in young women is limited. The aims of our study were to assess the prevalence of sexual dysfunction in a sample of young women and to identify the most common domain of sexual dysfunction, and also to explore the association between sexual dysfunction domains and sociodemographic characteristics, lifestyle habits, clinical conditions, and type of relationship. We conducted a cross-sectional study in a sample of 123 female university students. All data were collected via an online questionnaire, and sexual dysfunction was evaluated through the Female Sexual Function Index, which is a multidimensional scale for assessing sexual function in women and comprised 6 domains: desire, arousal, lubrication, orgasm, satisfaction, and pain. 160 fulfilled the questionnaire and 37 were excluded since they were not sexually active in the past 4 weeks. The great majority were nulliparous and have a normal BMI. Based on the FSFI score, 32.5% of the women were classified as having sexual dysfunction. Almost half reported exercising regularly, and the majority were non-smoker, reported consumption of alcoholic beverage, and were in a stable relationship. The majority take hormonal contraceptive, and for those not taking hormonal contraceptive, the great majority reported regular menstrual cycle. Almost 1/3 reported urogynecological disease, endometriosis, vaginismus, sexually transmitted disease or urinary incontinence, or other comorbidities like hormonal disorder or depression. There was no significant difference in the presented variables between women with or without sexual dysfunction. In respect to the different sexual dysfunction domains addressed by the FSFI, the orgasm domain obtained the lowest median value. Regarding the association between participants' characteristics and the FSFI domains, considering lifestyle characteristics, only smoking habits was associated with the orgasm domain. Concerning health conditions, the presence of comorbidities and urogynecological disease were both associated with lubrication, and not being in a stable relationship was associated with lower values in orgasm and satisfaction domains. Our take-home message: almost 1/3 of young women presented sexual dysfunction. Variables related to a health condition, lifestyle, and type of relationship were associated with some domains of sexual dysfunction, namely orgasm, lubrication, and satisfaction. Health professionals should be open to discuss young women's sexual health concerns. Our results should be read with caution, and future longitudinal research is called. We do not know if this change in sexual function persists into later adulthood or the impact of sexual dysfunction on sexuality. Thank you for listening.